Israel's healthcare system is famous for its tech, but its most important resource, its people, are on the brink.
And that's not just hype. The alarm bells are ringing at the highest levels. A perfect storm is brewing.
Get this, 70%. In one recent year, that's how many new doctors were actually trained outside of Israel. And that key supply line? Well, it just got shut down by a major policy reform back in 2019.
Oh, and it's not just about doctors. Look at the nurses. Israel is already lagging way behind the European average.
So, how did one of the world's best systems get here? Well, this didn't happen overnight. It was decades in the making.
For a long time, immigration basically acted as a bandage. But now, mass retirements are hitting, and that pipeline is closed.
And it's not just how many doctors, it's where they are. The shortage hits hardest outside the big city centers.
Just look at the difference. Tel Aviv has more than twice as many doctors per person as the southern region does.
This means hospitals in the north and south are facing a demographic cliff. It threatens their very ability to function.
But faced with this tsunami, the government is taking dramatic action to build a sustainable workforce from the ground up.
Okay, so what's the plan? It's a three-part strategy. Grow local talent, target the neediest areas, and attract global pros.
The goal is huge, to more than double the number of new medical students, from 800 to 2,000 by 2030. And these aren't just empty numbers. They're real programs to get doctors exactly where they are needed most.
All right, but what about the nurses? For them, the plan is to totally elevate the profession to attract new talent.
A key solution here is creating advanced roles like nurse practitioners, giving them way more autonomy and responsibility.
The bottom line is to make nursing an empowered academic career. That's the long-term fix for the shortage.
This really highlights the paradox, right? The startup nation has to solve a fundamental people problem, not a tech one. You know, Israel's situation is really a case study. Their rapid response could become a playbook for other nations.
So this is the big question, not just for Israel, but for everyone. How do you meet urgent needs and keep care top-notch?